know, back to school is quickly approaching, and Eye Center of Houston is taking care of the kids in our community in more ways than one. Joining us to talk more about this is Dr. Faheem. Thanks so much for waking up with us.
It's my pleasure. Good to be here.
So tell me a little bit first about pediatrics and when it comes to our kids' eyes. When should we get them checked? What do you guys all offer?
Right, so majority of times parents think that children just, if they have any visual issues, they need to go see the eye doctor. Right. That's often misconstrued. That's not the true understanding. Should be we need to be taking these children at 6 months. Oh. Second exam should be at 18 months, third at 36 months. And this is because just because you have clear vision doesn't mean you have healthy eyes.
Okay, this is good to know, especially as an expectant mom. I had no idea at all.
Congratulations, by the way.
Oh, thank you very much. I appreciate that. So what type of patients, pediatric patients, are you seeing?
Right, so right from the get-go, long before they even enter into school, we're looking for, and we want parents to know about some red flags. Anything from excessive tearing to any type of focusing issues, having obviously one eye that's preferred over the other. These are some things to look for, and we at the doctor's office, we're checking for any misalignment. We're looking for congenital cataracts, allergies, anything that could affect the long-term development of their eyesight and their vision. So majority of information that's being processed, roughly 90%, is through their eyesight. So having good eyes is a good predictor of how they're going to be long-term in their academic careers.
This is great and such important information to get through to people. Now I know a lot of people are listening to this and they're like, wait, this sounds expensive. So what about with insurance? You guys make this that it's available to everyone pretty much.
Absolutely. So we want to make it as easy as possible. So all insurances are accepted at Eye Center of Houston. Everything from Medicaid, Medicare to your commercial plans. We try to make it as accommodating as possible. Those who don't have the financial capability, we also have a nonprofit organization called I Give Sight, where we have a vetting process and vouchers so that you can't be left behind. You have to be seen.
Thank you for that. I really appreciate what you're doing for our community. You also are doing stuff to help kids get ready for back to school.
Right, so we have lots of back to school supplies, fun surprises for little ones. You don't want to make it so that it's an intimidating process for children. You want to make it as fun and friendly as possible. So we make it so that they leave with a smile and they get their eyes checked, and a lot of times parents are like, how are you checking their eyesight? And it's basic things from just understanding that the back of the eye has 270 diseases that we check for every time we do an eye exam. So it's absolutely essential that we get seen, they get seen, and we also have, they have a good time so that they're encouraged to keep coming back each year.
Yeah, it's not a scary place for sure. Where can people go for more information?
So eyecenterofhouston.com, or you can call us at 713-999-3565. You'll be able to reach one of our receptionists and we'll be able to get you in. We even have same-day glasses and same-day appointments as well.
Well, doctor, thank you so much for your time. I appreciate you.
It's my pleasure. Thank you.